Well, good evening, everyone. I'm going to go ahead and pick up. My name is Dr. Larry Rogina. I'm a board-certified obstetrician gynecologist, now retired, and I'll be hosting and starting the talk this evening. And we're going to talk about discovering Take Shape for Life and what that's all about. First of all, we all start our journeys differently, and the sailboat's an excellent example of charting a course, setting a plan and imagining what you would like to do and where would you like to go. When we look at Take Shape for Life and what we represent is we represent the ability for individuals to reach for and achieve optimal health in their life, which is actually balance between healthy body, healthy mind, and healthy finances. Now, me, on the other hand, several years ago, I did not really have balance. And instead, I was the individual that you should be seeing here on your screen in just a moment.
Larry, I'm having a little trouble. Hold on a second. There we go.
There we go. And back about 8.5 years ago, I was short of breath tying my shoes, on 2 blood pressure meds, 2 cholesterol meds, pre-diabetic, and had sleep apnea. I was delighted because I met an individual at a medical conference who was a health coach, and she was from Take Shape for Life. And she guided me on an amazing transformational journey. I transformed from the guy on the left to who I am now, and I not only was able to shed 90 pounds in a little over 6 months, I've been able to keep that off for now 8.5 years. So who is Take Shape for Life? Well, Take Shape for Life is actually the professional coaching division of the Medifast Corporation. Jeralyn, are we changing slides here?
I'm having just a little difficult. There we go.
There's an arrow on the bottom left that you can use to change it very easily.
Thank you, Greg.
We are a group of individuals from all walks of life. Tonight, this call is primarily focused on health professionals who might want to know more about what it is that we do. But our health coaches are not only health professionals. We have doctors, lawyers, restaurateurs, retirees, police officers, stay-at-home moms, and basically we're a group of people that just care about people. We're led by Dr. Wayne Scott Anderson, who's our co-founder of Take Shape for Life. He basically was an individual that he himself was in the medical profession on the front lines at Cleveland Clinic. He was one of their first board-certified intensive care medicine specialists, and he got tired of putting out fires and really not changing people's lives other than delaying the inevitable, which was simply saving them at that moment when they came in the throes of near-death experiences. He went to the Medifast Corporation, which is our parent company, and said, you have some really great tools to help people lose weight and get healthy. So what I'd like to do is I'd like to talk a little bit more about where are you now? I personally was not healthy back 8.5 years ago. And as a result of my transformation, my family, my friends, my patients, other individuals wanted to know what was I doing. So I would ask them the question, well, really, how healthy are you personally at this point in time? And we don't just look at their body, we look at, is there a balance between body, mind, and finance? What we have here on the slide is what we call our trilogy wheel. The trilogy of optimal health is that balance between body, mind, and finance at your life. And if you were to score yourself from 1 to 10 in each of those areas, you would be able to determine, are you currently balanced? If your body is pretty good and your mind is pretty good, but financially you're really struggling, it is bound to impact those other areas of your life. So the next question is really simple. If you could start somewhere, if you could have optimal physical health, would you want it? And that's a question that was posed to me 8.5 years ago. And I posed that same questions to my patients when I was in practice, although now I'm retired. So what we'd like to do is we'd like to start by focusing on physical health. And by physical health, I don't just mean weight and BMI. It's really about getting to and maintaining a healthy weight, because everyone can lose weight, but not everyone can keep it off. So what we are going to do is we're going to promote not only a healthy weight, but healthy eating habits for the rest of your life, healthy activity or motion, or exercise, healthy sleep patterns, and of course, reducing stress in your life. But where do we start? We're going to start with weight. Now, we do have an epidemic in the United States. As you can see from this slide from the CDC, over 80% of the country right now has obesity rates in the 25% or higher category. And there's a couple states on there, Mississippi and West Virginia, for examples, that are greater than 35% when it comes to obesity. Well, we only have a few states that are less than 25 or less than 25%. So we do have a crisis right now in today's society. And what is this causing? Well, we know that obesity is replacing cigarette smoking as one of the leading causes of medical problems and even mortality. This is a slide that came out of Cleveland Clinic from their research department. And basically, that slide that we just had there talked about if, in fact, you're able to reach a healthy weight, you might be able to reduce your overall risk of disease. And there are some classic examples on here that everyone can understand. Metabolic syndrome, which is the combination of diabetes and hypertension, cardiovascular disease. Polycystic ovarian syndrome side effects are reduced or eliminated. Asthma is improved. And even something as simple as gastroesophageal reflux disease is markedly reduced when we reduce our weight and get closer to a healthy BMI. So I'd like to continue to move on. What do we, as Take Shape for Life health coaches, offer our clients? And this is pretty simple. We offer them a comprehensive program to move in the direction of optimal health. Now, optimal health might be different for everyone, but what we're going to start with is three key components. A health coach who's your trusted guide, who'll be there every step of the way with you and move you through the system. A lifestyle program that's going to allow you to change how you think. And we do have some meal replacements from the Medifast Corporation that are there as a tool. So I'm going to get into specifically how we use those meal replacements next. The first thing we're going to do is we're going to help our clients reach a healthy weight. And we're going to use the Medifast 5-in-1 plan. 5-in-1 stands for 5 meal replacements. And then 1 time a day, you'll have a meal that consists of a lean protein and 3 servings of non-starchy vegetables. It's pretty simple. Medifast meals, many of them are extremely portable. And I know for me as an OBGYN physician and surgeon, it was nice to know that I could just keep bars in my surgical locker. I could have a blender at my office and whip up a shake. And the only thing I needed for most of these things was a microwave, maybe except for the pancakes. But we've got over 80 different types of food, flavors, and textures to choose from. But the cool part about those is they're completely interchangeable. They have almost all the same nutritional footprint. And the research behind them is amazing. It was studied at Hopkins and NIH, and it is clinically proven to be one of the most effective ways for people to lose weight. But remember, once a day, we're having a meal that consists of a lean protein and non-starchy vegetables. And I'm talking 5 to 7 ounces of that lean protein, whether it be beef, pork, lamb, chicken, turkey, or fish. And those non-starchy vegetables, I was actually pretty amazed. It was rather difficult to even consume my entire meal once I got started on the program and my stomach started to shrink from not eating the volumes that I used to. So I'd like to move one step further. Our clients and most of your patients out there, when we get them in our offices or we run into them at the mall or at Walmart, they're existing in that before phase of their life where their calories in are much higher than their calories out. And as a result, they're accumulating fat. So we get them when they're ready to look for transformation in their own life, and we'll start them using that Medifast 5-in-1 plan. We don't really kick in a whole lot of activity from the start, but we reduce their caloric intake with the use of the meal replacement program below their caloric expenditure. And after a couple of weeks, we start to increase activity very slowly. Once we get to a goal weight, which is usually in the normal BMI range of less than 25, then we begin to talk about how can we transition? How can we increase the number of calories someone's putting in. At the same time, increase their activity until we reach a steady state and we allow them to optimize for the rest of their life. Well, take Ron Gels. Ron Gels is an amazing guy. I met him probably 8 years ago at one of the events that I went to. Ron was able to go through that phase 1 where he reached his healthy weight over 8 years ago. But the cool part is he didn't just lose weight like most people on a diet with the likelihood of success of 15%. Ron is living the habits of health lifestyle, as we call it, and has been able to keep his weight off now for well over 8 years, as am I and my wife and many of my patients. Next slide. What I'd like to do here is I'd like to bring in a board-certified OBGYN physician, Dr. Jeralyn Brossfield, who's also a director of a wellness program in Southern California. And I'd like to have her address how we're going to create long-term health, not a temporary fix. Jeralyn.
Thank you, Larry. In my practice, when I first started looking for a tried and true program that I could use with my patients, and I was introduced to Take Shape for Life after really 9 years of having tried everything else that I could, with a lot of time and effort spent with my patients, and it really a sense of failure on my part, because I felt like the harder I tried, the less I was seeing success. I really wasn't seeing people fully transform their lives. So when I learned about Take Shape for Life, I dug in to study it, and it was this habits of health system that was really what sold me, so to speak, on the program. I was so excited to see a guidebook for people. I had been considering writing one myself, and found something even better that was comprehensive. And Dr. Anderson had created a system that not only I now use as a reference resource with patients, and my patients still refer back to their Habits of Health book, even when they've been healthy for 5 years and are moving into ultra health. But I also really appreciated the companion guide that goes with this, that allowed a self-study program that I could then support and augment from my office. So our Habits of Health system really is the difference in helping people have something that they can learn to incorporate into their own lives and keep moving forward to the next step of health for themselves. And so our system combines the eating program you were mentioning, Larry, a very simple structured eating program, with the Habits of Health educational system. And then also the community aspect and the coaching aspect have proven instrumental in my patients maintaining their new healthy bodies and moving on to health. As a health coach, what I've loved is that as a physician, I began by coaching my own patients, and it really built on the relationship that I had built with my patients to become their coach. I was extremely invested in wanting them to succeed, but I also was able to be a partner walking alongside of them in this journey, and helping them move forward. One of my very first patients that I started on the program was named Shauna, and Shauna was someone who was near and dear to my heart. I loved her as a person and as a patient, but I was very, very concerned about her. I was worried that she would have a heart event. Her inflammatory markers, her C-reactive protein was over 18, and her lipid profile was extremely concerning. And when I first made the offer to Shauna, I asked her, would you be willing to take a step towards becoming healthy? And she actually declined. Like so many of our patients, people have tried so many things that there's a crisis of hope and almost a shying away from something where you might fail again. But it was meant to be that Shauna came back in a couple days later and said, I'm willing to try that. And so you can see the before and after here. Not only did Shauna transform her health, within 6 months, she had lost 65 pounds and also dropped her C-reactive protein to the normal range. She had also, in that interim of time, helped her husband start the program and wanted to become a coach. And her becoming a coach not only helped her husband get to optimal health and get off of his diabetic medications and have a new lease on life, but it really, as I speak with Shauna now, and any of you who know Shauna, one of the most instrumental factors in both Dick and Shauna maintaining their health has been that they became health coaches. and they put themselves in a place of accountability and a place of growth as people. And so it's been a continual process of learning and being able to move to the next level of health, but also maintain a healthy weight because of their choice to be health coaches. So it really all began in the office that day for Shauna, for instance, with the question, are you ready to take a step towards optimal health? And I think so often we physicians are in a role of telling people what to do that we don't always feel equipped or don't always know what to ask to help them make a move forward. And often a question is a more pivotal starting place. So in asking that question, are you ready to move on towards optimal health? One of the things that has been probably the biggest gift for me as a health coach and a physician using this program has been the healthy mind component. I didn't have a large physical transformation. I had a huge benefit to reducing hypoglycemia and reducing anxiety for me physically, but the healthy mind has probably been the part that I have felt the most growth and reward for myself personally. And part of that just is that as physicians, we struggle in a high stress field. There's a lot of changes and a lot of things going on. And I think that our own sense of whether we're really achieving our purpose and doing what we came to do as a physician can often suffer. I know, as I mentioned, I had felt like a failure in not meeting the needs of my patients to help them change until I found this program. And so that transformation of seeing success in my patients, partnering with them, and then also being able to start building my own healthy mind and my own better health really was a rewarding time, and it continues to be as a health coach. You know, we know that we have an obesity crisis, but we also have a crisis of hope. If you look around, I would wager that every one of us on this call knows someone who is struggling with depression or severe stress or despair. And actually, Larry, I wanted to ask you at this point, you know, you have shared with me a time that you went through in your own life that was a severe, stressful situation. And would you mind sharing how a healthy mind, how that impacted you through that time?
Well, absolutely. I'd be delighted. I have to go back to a day that I'll never forget, which was May 10th of 2013. I developed a variant of the Guillain-Barré syndrome, and it caused double vision and fine motor skill ataxia or fine motor skill problems. And as an OBGYN physician and surgeon, in an instant on that day, suddenly everything that I trained for was gone. I probably should have been either medicated or admitted because I spent 6 to 9 months sitting on a couch feeling really sorry for myself. I thought my life was over. I really did. But just when I was in a dark place, like I had been in a dark place physically probably 6.5 years ago, my coach stepped in and she asked me a question. What was the most important thing that you did as an OBGYN? And well, you know, I delivered over 4,000 babies in 27 years, and I was delighted by that. And she says, well, look at how many lives you've touched as a Take Shape for Life health coach. And suddenly I looked around me. My wife was 75 pounds lighter and was feeling amazing. My daughters all reached normal and healthy weights. My patients had reached healthy weights. I had coaches and clients that had reduced or eliminated medications. And I realized at that moment, what I was doing is exactly what I went to medical school to do. I personally realized that meaning and purpose was there. It was still there. And I was just excited. All of a sudden, that depression, that concept that my life was over was gone in an instant. And I can't wait for tomorrow because I want to help more people achieve the transformation and the health that they want.
Thank you, Larry. Your story continues to inspire me. And I think that reward that we each gain as a health coach, seeing people fully transform their lives, there's nothing better, actually. Another area of health that we address with Take Shape for Life is healthy finances. And I actually want to ask Dr. Greg Czer to join us at this point. Dr. Greg Czer is a triple board certified internist. He is an intensivist and a pulmonologist. and lives in San Diego, California. Greg, are you with us?
I am, Jeralyn, and thank you for introducing me. And I appreciate the opportunity to talk this evening about this topic because, to be honest, when I was first introduced to Take Shape for Life and this idea of the trilogy, I didn't really get the healthy mind and healthy finances part. But over time, I started seeing it more and more. Initially, I was interested mainly in looking for a program to help my patients that was clinically proven, scientifically sound. And that was my initial reason for looking at Take Shape for Life. My history, I've been a physician for over 25 years. And as with a lot of physicians, there's been increasing amounts of administrative burden, insurance hassles, and most recently, electronic medical records mandate with meaningful use criteria, which are pretty burdensome. And a lot of physicians are feeling a lot of burnout related to this. Next slide, if you could, Jeralyn. Thank you. This recent report in 2015 said more than half of physicians are feeling significant burnout because of those types of issues. But even more importantly for me than those type issues was the frustration I was feeling that over time, more and more of my patients were suffering from obesity and obesity-related disease, and I really had no good solution to offer them in my practice. And they were frustrated as well. And I was looking for a solution. So, next slide, please. For us, it was when we were introduced to Take Shape for Life about 5 years ago. We brought it into our practice. And in the first year that we had Take Shape for Life in our practice, our patients lost over 6,000 pounds. And many obesity-related diseases resolved. I was able to stop or reduce a great many medications. And more importantly, my patients finally felt empowered and finally felt they had the tools, as Jeralyn and Larry discussed, to maintain themselves at that healthy weight and take control of their health. And so I had very happy, very grateful patients, and I was starting to get an idea of this healthy mind part. Next slide, please. So how are we able to have such success quickly? Well, Take Shape for Life has a fairly unique business model. There is no inventory that we keep. The initial cost investment is very low, and as a health coach, when a patient decides to become a client, we help them place an order with the company directly, and then the meal replacements are shipped directly to their home. And any issues with the meal replacements is handled directly by the company. Our role is solely as the health coach. And we have a business coach who maps out a customized plan and is with us every step along the way and provides us with all the tools necessary for success. And that's really kind of the magic. We have a whole team of people behind us that will do an analysis of health professionals' practice, see what their needs are, what they want to accomplish, and then formulate a plan to help them achieve that. Some health professionals, like Jeralyn, opt to coach their own clients and patients. Others are really busy and have a health coach in the office, and others will have a health coach that they refer to outside of the office. So it really depends on what's the best fit for you, and that's what we help you achieve. Now, what kind of revenue can be expected? Well, your business coach will help train you and your staff to support and enroll clients. And if you have about 20 clients on a consistent basis per month, you can expect to add additional revenue to your practice of about $25,000 per year. If you maintain 50 clients on a regular basis, about $50,000 per year, and 100 clients, about $100,000 per year. And those numbers are realistic. I remember that our first month we signed up about 25 or 30 clients, and my wife, who was the coach for our practice, yells across the office, "I think we got our first check," and opened the envelope, and she goes, "I think they made a mistake. I think they paid us too much." So these numbers are real, unlike insurance companies, which discount us or don't pay part of what we bill. what Take Shape for Life says they will pay us, they deliver. So it's really been a blessing. Now there's two ways that we create time and financial freedom in Take Shape for Life. One is through what I just discussed, and that is coaching clients and the income that Take Shape for Life pays us to support and guide them on their journey towards optimal weight and health. The second way, which starts a little slower, but eventually has the potential to exceed your client income, is through team coaching. Now, why does client coaching income plateau? Well, there's a limited number of hours per day. You can only support so many clients yourself, and at some point you hit a plateau. On the other hand, why would you want to consider team coaching? Well, several factors. One is it extends your reach. You can reach many more people just besides your own practice. And for myself, creating health in my community was a really important thing. The other thing, other health professionals in your community may see the success that you're having with your patients, and some of those patients may cross over into their practice, and they're going to see that and want to know what you're doing, and may want to join you. Some clients, when they've lost and become very successful in achieving their optimal weight, have family, friends who are clamoring to do what they did, and they'll try to refer them to you. And for us, we were just really busy dealing with the patients in our own office. And at one point, it came to the point where we had to really consider, can we handle coaching more clients ourselves? We kind of hit that plateau. And I'd like to bring on one of our very first clients, James Olson, and talk a little bit about his experience and how he decided to become a health coach. James, are you on the line?
I am, Greg.
Well, thank you for joining us this evening.
Thanks for having me. It's a real honor. I believe on the next slide, there we are. As you can see over there on the right-hand side, that was my reality for as long as I can remember, all the way back from kindergarten or grade school. And that went all the way through high school, into my 20s, into my early 30s. And, you know, a lot of things come with that, such as, you know, bullying and missing out on things. And by the time I reached my 20s, you know, I was starting to have knee problems. I thought that I was going to have knee replacement. I was in construction and snowboarding, hunting, doing a lot of physical things. And at that weight right there, that really takes a toll on you, along with the mental toll. And so I was blessed to have two little girls in my early 30s and realized that something had to give. And honestly, I thought that that was going to be surgery. And the other part is watching my family. I knew that adult diabetes were coming. They all had knee, hip, shoulder replacements. I knew what the future offered if I continued down the same path. So as I was researching surgery, my wife went to the doctor's office, the Dr. Czer's office, and they had flyers up in the office, and she came home and said, I don't know what's going on, but they're doing something down there, and I think we should go see what's happening. We got childcare. We went down there. I sat there for a half an hour, tried some of these, what I would say are candy bars, and I figured, you know what do I have to lose? I can give you 30 days dedicated. And sure enough, by the third day, I was telling Denise, Greg's wife, that, you know what, I've got this. And with my busy lifestyle, this worked. And the pounds just came off. 6 months later, I changed my goal 3 times and 80 pounds were gone. And my wife at the same time had lost 55. So 135 between us. And honestly, I thought that the life I was living was going to be the life that I would die with. And so it was just amazing for the first time in my life to be where I wanted to be and get back to what I wanted to be doing. I was back snowboarding. I was back to hunting. I was down with the kids at barbecues. I was the father down there playing with everybody. And it was so much joy. Well, everybody's asking, what are you doing? What are you doing? At first, I was hiding it because I was convinced I was going to fail. But then I started telling everybody. And finally, Greg and Denise said, listen, are you going to help your friends or am I? And I said, you know what? I have fun. And you know what they said? It was one thing. Health coaches are 5 to 6 times more likely to keep their weight off. I didn't care about the money. I didn't care about the business. It was, okay, I'm going to keep the weight off this way. But you know what happens is I couldn't dream what has happened in the last 5 years. There's no way you can dream big enough when somebody asks you, what do you want out of this? And sure enough, my wife is stay at home. She never went back to work after the birth of our second kid. We donate a tremendous amount of money and time to the school. I'm on the wellness committee for the district. Last night I was speaking in front of the superintendent and the board about wellness and the work we're doing and getting the PE program back into the schools. And I have met so many amazing people through this business that anywhere we go that is so-called work is more like a retreat on a, you know, what Carnival cruise ships you might be thinking of, or it's all fun and games. But you know what? It is serious business and we have a lot of work to do. So I just couldn't say enough in the way to say thank you to everybody, all the mentors, and the opportunity we've been given and what it has brought our life. And our kids are headed in the right direction to not follow my footsteps. I'll finish on one story. I think it was first grade, beginning of first grade, the kids are talking about what are a healthy snack. And the kids are talking about their fruits, you know, gummy bears and fruit rolls, and some thought chips or chocolate milk. And my oldest raises her hand and the teacher calls on her and she goes, well, you might not know this, but a MetaFast bar is one of the healthiest things you can eat. It's full of protein, low in sugar, and is well balanced. And we used to call it yucky food at first, and they know the UPS guy is the yucky food guy because we were hoping that they wouldn't touch it. Well, now both our kids, first and third grade, their choice, they take a MetaFast bar for their snack, and they love everything. So thank you very much.
Well, thank you, James. And that's why we are in this business, and why we bring on coaches such as James, is to extend our reach. And really, it's a powerful motivator and really gets me reinvigorated in my passion, that reason why I started in healthcare and in medicine in the first place, and that is to impact the lives not only of my individual patients, but their families long term. And James is a perfect example for that, and thank you for sharing, James. And so how are we paid for business coaching? Well, the company pays us for mentoring our individual health coaches and helping them succeed, like James. And then over time, some of those coaches that are some of the clients that our coaches will bring on will also want to pay it forward and become coaches. And at that point, we are helping develop teams of coaches, and we're also paid by the company for that part of our activities. So what does that business leader income kind of look like? Well, you can see in the green column, depending on how many coaches and how many teams of coaches that you bring on. Initially, when you're just starting to support coaches at the level of executive director, this can take 6 months, a year and a half. The average income is around $61,000 per year. And then as you start developing teams of coaches, that goes up from there. So the question is, and that takes some time, usually over several years. But the question is, what would an extra $60,000, $80,000, $100,000 mean to you and your family, and what you could do? And that's really an important thing to think about. Next slide, please. And with that substantial income, the question that you might have is, well, how much does it cost to get started? Well, I mean, if this really makes sense to you, if you want to help improve the health of your patients and start on this journey, the investment is only $199, and that's for your health coach kit, which includes all the materials you need to set up your office, and a very sophisticated web platform that helps support your clients, takes the client orders, and also a second web platform so you can monitor the business. So the investment really is pretty minimal for what we're able to achieve. And the ultimate question comes, is your life organized around what matters most to you? And after our initial success with our patients and the dramatic weight loss and improvement in health, I really kind of reoriented my practice after spending some time talking about it with my wife, away from treating end-stage disease in the hospital in the ICU, and more towards creating health, intervening much earlier in the disease path, getting patients to a healthy weight and trying to maintain it. And with that, I had more time, yet despite having more time for family and other activities, our income improved. And before this, we had 4 kids who had gone through college, and my retirement plan really was not in very good shape. But after joining Take Shape for Life, my retirement plan is fully funded. And I work in the office only a few days a week now. And that's provided the opportunity for us to help our children out. Our youngest, who is pictured there on the left, is going to be graduating from medical school this coming spring, and he will graduate from medical school debt-free because of the blessings that we've had from Take Shape for Life, and that's something pretty special. The other thing, because of the time and additional financial freedom, is we've been able to arrange for family get-togethers. Our children and their careers are scattered across the country, from Northern California to Washington, D.C., and in between. And this past spring, we all gathered, and our oldest son's in Washington, D.C., and were able to share this special moment with our youngest son and our oldest son, as they had this moment of bonding. And before Take Shape for Life, I would have never had the time to take away from my practice to do that, nor the financial wherewithal to make it happen. And the other thing that's important to us is our community and volunteering to causes we're passionate about. And we've been able to spend time and donate to our local hospice house, and see that really by being on the board that helped create this hospice house, seeing it go from an idea to reality over several years. And that's really what impacts us, and really feel now that our life is truly organized around what matters most to us, and that's our family and community. So is your life organized around what matters most to you? Are there things you would like to do that and dream about doing that you haven't been able to do because of the constraints that you're currently under? And do you see that perhaps joining us in Take Shape for Life might be a vehicle to get you there? If you see that your patients could benefit from this program that is both scientifically sound and clinically proven, then that you might want to consider it. If you would like to create more time and financial freedom in your life to do the things that are important to you, again, please join us. What's the next step? The next step is to get together with the person who invited you to this webinar this evening and discuss things further. And I'd like to thank everyone for joining us this evening. I hope this has been an informative discussion. Thank you.